Thanks for joining me, everyone. Charles Moscowitz here. Al Sanchez is my guest. Dr. Al Sanchez specializes in cancer research. He's got some cutting-edge information with regard to the latest in cancer and cancer cures. Al, thanks for joining me this afternoon.
Thanks for having me. Appreciate it.
Al, cancer research is something that I think in this next year, or maybe even later this year, there's a lot of cutting-edge things that are going to be coming out, not only in terms of how to treat cancer, but also what cancer actually is and how to detect it. So talk a little bit about your information on the latest in this area.
Well, I think what it is, a lot of times they regurgitate some of the same information, which is kind of funny. So when you look at it from decade to decade, look at the 80s, look at the 90s, look at 2000s, now look at, 2010s and now 2020 and where they're going. Immunotherapy right now is big. Well, they were doing immunotherapy back in the 70s, but now they're a little smarter at it because we have a better understanding of it. So, many times people talk about history being cyclical, and this is no different. So it's nice to see that they're able to apply what they're learning. I wish it was at a faster rate, but unfortunately, especially in cancer, it's a slow mover. And a lot of people are still dying from it, and the numbers are still growing. So that's the downside of it, that they really haven't changed the long view of cancer, which I'm hoping that they're going to change. But they're getting better at quality of life. They're getting better at detecting it earlier. So that's giving them an upper hand in many situations. But the advanced stage cancer patient is still really has no options.
The so-called war on cancer was launched in 1972 during the administration of Richard Nixon, with a huge amount of federal dollars pouring into research universities and research hospitals. And while on the surface I applaud that effort, there's also, I suspect, a downside to that, in that there becomes a financial incentive to keep the money coming, and like anything else, it becomes a business. And I wonder if this has not caused, in a sense, ironically, a slowdown in a study of actual cures for cancer, if not means to put cancer in serious regression. What do you think?
Well, it's interesting because, those things ebb and flow based upon the administration, right? So whoever's holding an office, whoever's doing this funding, and then all of a sudden funding gets cut. So let's say they did some great research and they were in the middle of it, and then all of a sudden some new administration comes in. 2 years later, that funding gets cut, and then everything that they did pretty much comes to a grinding halt. And then it's this fighting for it once again. And that's part of it, is the politicization of cancer, which has actually caused more problems. Like you said, in 1970, here we are 50 years later, and cancer rates are still increasing. The death rate of cancer is still number one if you factor in all the side effects. It passed heart disease probably in the late 90s, which I really find detestable that they don't even really put that out there. That if you die from a pneumonia because you had cancer because of the therapy, that's not what you died from. You didn't die from cancer. You died from pneumonia, even though it was because of the cancer. It's a really little sleight of hand that they do.
Right. So the way they keep these statistics is a bit cooked, and also such treatments as chemotherapy, from my understanding, it's highly toxic and very poisonous. Not that it doesn't work, but the point is that it can kill you in the process. It destroys healthy parts of your body while trying to kill the cancer. So, I suppose, again, I'm not a doctor, you are, but it may not be for everyone. It may not necessarily be the best treatment in every case.
And that's it. And that's where, at least, this immunotherapy, they realized that the chemotherapy and the radiotherapies were doing more damage than good. And they were giving such high doses prior to the 2000s. So their increase in treatments of cancer improved in the 21st century, but not because their types of chemotherapy and radiotherapy improved. They lowered the dosage, and they started extending the time of treatment and giving the body time to heal from the chemotherapy, which is common sense medicine. So now they come in with this immunotherapy going, well, we need to target the immune system. It's like, well, no kidding, And so now they're kind of re-looking at the older research, and you have newer people that come in and they say, how do we do this? Well, let's try this. And that's where we're at now. Is immunotherapy is the new cutting edge terminology in cancer, although it's bringing it back from the 1970s.
Okay, my guest is Dr. Al Sanchez. Al, what is cancer?
Cancer is your own normal cell that didn't grow up.
How can we grow them up so that we don't get it?
You know, my simplest analogy and metaphor for that is for all of us that have ever tried to grow plants in our garden or in our lawn or front yard or backyard, you need good soil, clean water, no pollution, and nutrients, and some sunlight. You keep that environment healthy and right, and what do you get? You get good plants, low weeds, no problems. You somehow don't get that chemistry correctly, and what happens? Abnormalities, things don't grow well, lots of weeds, you have problems. So in a simple nutshell, that's how.
So then I guess that conversely, what you're saying is that someone in many cases, and we're not generalizing here, but a person who is diagnosed with cancer is someone who hasn't taken care of the garden, so to speak. And that not only could be physical in terms of taking care of their health, taking care of their body, but also maybe emotional. I mean, I think it's interesting that, and correct me if I'm wrong, but isn't there an increase or an uptick in cancer cases around the time of Christmas every year? People, who might be lonely, they've gone through a divorce, they've had a trauma, they've had a death in the family, they've had some reversal in their personal life, that they're vulnerable to something like a cancer at that particular time because there's a lot of heightened emotion and people, it's a family time. Is that what you're basically, in a nutshell, what you're saying here?
Well, I mean, there's no doubt that the emotional mindset and where our head at does not play a significant role. And, a simple analogy for that is think of a happy thought and you kind of lighten up, you breathe, you get a little excited, you get some adrenaline rushing. Well, think of a sad thought. What happens? Your head drops down, your breathing goes shallow. And these things ultimately are going to affect our bodies physiologically. So anybody that's going through a stressful time in their life and has that chronic stress, yeah, it's going to be a disease increasing in general. And that's what we've seen across here, and especially in the United States, is the higher the stress, the worse the disease, the worse people feel. And then that translates into bad eating, poor lifestyle, which then accelerates, something like cancer or degenerative disease, as we call it.
No, I mean, I can relate to that. I mean, it was probably about 6 or 7 years ago. I was going through a rather difficult period in my life, and I came down with a very minor cancer that was removed, and I've been fine ever since. So it's brought me great interest in the subject. And one of the things that I did after having it removed was I got into looking at alternative medicines. And I know that this is probably all, placebo. I mean, I've improved my health overall, but I started to take doses of turmeric. I started to take kelp because I understand that has iodine in it, which tends to counteract the radiation of in the atmosphere that's everywhere now. Correct. And several other things. I mean, garlic, something as simple as that, and beet. And I take these things every day. Now, what do you suggest or recommend for maintaining health, recovering from certain illnesses?
Well, I mean, all the things you mentioned are highly supportive, and they target inflammation. They support the immune system. In your case, like you said, mentioned with kelp, that's supportive of iodine, which is protective of radiation and the depletion that goes along with that. And there's so many more. The difficulty is like which one specifically. So if I had to pick my top three, my top three would be vitamin D, coenzyme Q10, and lipoic acid mineral complex that gives you that nutrient support. So that way, you're kind of covering all the bases in your top three. Now, having said that, I take probably 10 or 12 on top of that. I have a limit. No,
that's amazing because I take all three of those also at this point, and I've done some research. And I mean, I can't say I do it every day, but I do it maybe 4 or 5 days out of the week. And I can tell whether or not I feel like taking it. And if I don't feel like taking it, I don't take it. Because somehow my body tells me whether or not, it's a good idea.
Well, when you're in tune with that, it's interesting, the older I've gotten, that's on my mind. When I was in 20s and 30s, that really wasn't on my mind. But now, seeing what I've seen, knowing what I know, realizing how important that is, it's no different than, maintaining your garden, or the one I like to think about is, because we all have a car, or at least most of us have cars. When you maintain a car, how does it respond? How long does it last? Let's put it that way, right? Take a car and keep it in the garage, wash it once a week, wax it once a month, do all your maintenance. How long is that car versus leaving it outside, never washing it, never changing the oil, never rotating the tires, never changing the brakes? What's going to happen to it?
Yeah, exactly. You take care of your body in the same way.
Exactly.
It's not going to just go automatically. I mean, you have to maintain it. And I think it does have to do with where you are spiritually as well. I mean, it's, at that time I was going through a very difficult time in my personal life, and I straightened it out. But, you have to, when you're in a vulnerable place like that, you have to be extra careful to watch, yourself and to listen to yourself. And I know this sounds simple and there's no medical backing for it, but I actually think it's very important every day to breathe consciously. We all breathe because we wouldn't be alive if we didn't. But there's nothing wrong with stopping and just inhaling through your nose every day and oxygenating your system. And try to breathe into all extremities, breathe into your fingertips, breathe into your toes, get your blood and your body oxygenated. I don't think we do that enough. I know that, again, I'm not a doctor, but I've looked into it more than casually. And to do that, it just, it strengthens your body, it strengthens your being.
No, so yes to everything you just said, and also yes, there is research that supports that, Charles.
Okay, really good.
That breathing exercises are wonderful, simple, healthy, de-stressing, invigorating. When our body yawns, many times it's not because we're tired; it's because it needs more oxygen. It's a safety check valve that we do because we're not breathing. Think about it. We all have stress in our lives. We're all busy. We all got schedules and kids and family and work and social and all these things that, we're trying to integrate, and especially in today's technologically crazy world. We don't breathe. We shallow breathe.
Right, exactly.
We're using only the upper, maybe 50% of our lungs. So, like you said, when they call it belly breathing. When you breathe in through your belly and you actually distend your belly and your gut, that forces blood. Well, guess what? People have a misunderstanding of our heart. Our heart pumps the blood, but what pumps it in and out of what's called our lymphatic system? That's movement. That's exercise. That's getting up, getting down. That's lifting, that's moving. That's going this way, that's going that way. And how many times, you see it in the animal world. I love watching, I have a dog, and what's the first thing cats and dogs do when they get up, right?
Right, they stretch, yeah.
They go all straight. And we kind of do that the same way. Why does that feel good? And then all of a sudden you can get going, right? And when you're younger, you don't need as much, but that's blood flow, that's lymphatic flow, that's oxygenation, that's tissue, that's health, that's moving these things to that's helping our kidneys, that's helping our livers. That's why people, they talk about exercise, they go, I don't care what you do, just move. Get up and get down 30 times out of your chair, but move.
And we're all much more sedentary now. My work now is a lot more sedentary than it was back in the day. And so, I know, again, this sounds like it's corny and it's not medical, but I find that it's very important to have at least a brief walk, maybe not every day, but at least 2 or 3 times a week, and to put down the cell phone, put down the smartphone. You can keep it in your pocket, but don't look at it, and just walk and breathe, and you start to solve problems that you're dealing with. You start to think through. The other day I'm walking up the hill and down, and I started to examine certain things I'm doing right now in my business and whatnot, and you begin to work through stuff that you might not have thought about otherwise. So it's good for the brain. It's good for the spirit. It's not doesn't. And I hate exercise. So I mean, the walking is something that you can do.
It's a very simple thing. And then you take that walk and you go put it somewhere in nature, where all you hear is nothing but the sounds of nature. Our minds are connected to that. Why do we always? I don't know of anybody that doesn't walk or be around nature and go, wow, this is really nice. This is peaceful. This is quiet. And it makes a difference. It makes a difference in our mindset. It makes a difference in our body and our physiology. These things now have actually been measured. So like you were saying about breathing, you put yourself in a nice, tranquil, quiet, outside environment, ocean, lake, birds chirping, whatever it might be for you. That is mind-blowing what that does for one's health. Like you said, in stress, your brain thinks about things. It's why people, and now I understand it even more so, meditation, deep prayer, deep thought, deep connection with a loved one, your family, thinking about those types of things where you give your spirit that support is wholly important.
Oh, I mean, absolutely, which brings me to my other point. I think that some kind of connection to faith is important for health, a belief in a creator of the universe, and even an organized belief in terms of going occasionally to a church or a synagogue or a mosque or wherever it is that you pray. It kind of requires you set aside a certain amount of time, you get together with other people, and you contemplate these greater factors in the universe. I know in my case, recently, I was, going down the street and I was not accosted, but I was approached by a Chabadnik. I happen to be Jewish. And, these guys that drive around in my town with a little van, and they come out and they say, are you Jewish? And if you say yes, they go, well, let me wrap tefillin, which is these black straps that Orthodox Jews wrap on their left arm every day and pray. And so I said, okay, fine, I'll wrap tefillin. So they wrapped tefillin, and I said the prayers. And what it made me realize, besides the spiritual benefit of doing this and the centering benefit of wrapping tefillin in the morning, and it makes you almost feel like a warrior, like you're ready to face the day, is that the process of wrapping that black strap around your arm 7 times, it helps your circulation. I know this sounds nutty, but for somebody who might have high blood pressure, you might have heart issues. I think there are some medical statistics that show that people who wrap tefillin every day, and you get that constricting in your arm, it's good for you. There's a certain amount of I've seen now advertised, for example, people are getting these constricting T-shirts to kind of hold, I think that kind of stuff is good, no?
At a certain level, it is absolutely good, because human interaction and human contact is hugely important. And we've already proven that from child raising to ongoing health care for the elderly. We as human beings are touchy-feely. We need to touch. We need to interact. We need to communicate, whether it's bridge, whether it's, politics, whatever it might be. It's a good thing, So that's important. And then you bring in the touch factor. You bring in the wrapping around the arm. Yes, and any type of, even massage. Just take your hands and rub them together, right? Yep. You'll feel what goes on. People that crack their knuckles, and that goes on. You grab your arm and move it around. Whatever that is, there's something to it that's beyond our level of understanding. So the more one can do that, the healthier one is.
Absolutely. Like I like to try to grab the imaginary baseball. Whatever it is that gets the blood flowing, especially in the extremities, is very healthy. Now,
you reach up, you stretch out, you pump your neck, you're kind of just,
Well, I don't recommend popping the neck. That's another subject. But certainly the stretching is good.
Well,
excuse me.
You don't force yourself, that's for certain. So you never force your neck over. But if you do that in the natural motion of things and it pops, so be it. That's okay. The synovial fluid and the air that is escaping in the pop is totally fine, that you stretch. That's good. That's releases the joy. But yeah, no forcing of any.
No, I just don't recommend it. That's all.
Right.
The conventional medicine has an important role, but they don't open the lens up a little bit and see oftentimes these sort of factors. Like, I don't think that to get a medical degree, and correct me if I'm wrong, I don't think they spend too much time talking about supplements and vitamins and things off of the prescription grid. In fact, they're against them. In a way, they've tried to make them licensed and whatnot. And while I support conventional medicine, certainly, I think that the wise consumer combines the conventional with the alternative. Both sides tout themselves as the great answer to everything. Neither side is. The answer is a combination of both to a process of trial and error to find out what works for you.
It is. You're absolutely correct. That's why we call it integrative medicine. You can't. Drugs and the pharmaceutical industry have their place. Wonderful things that are done, for people that have various conditions, heart conditions, different diseases, even antibiotics. Let's take that. That's a simple one that most people know about. However, when you take antibiotics, you're also killing all the good healthy stuff. So why would you not take any pre or postbiotics to return that good healthy gut flora to your intestines so that you don't have any other digestive issues? So they both are correct. This one is not going to help you by itself. This one is going to cause other problems. Yet if you put them together, you have a win-win situation. So you integrate, definitely. And what are our bodies made out of, right?
That's right.
Vitamins, minerals, amino acids. And if you're not, eating just purely farm-to-table food every day that in any way, shape, or form has been processed, it is being depleted. So you need to supplement. That's the whole point of dietary supplements. They are supplementing our diet.
That's right. I mean, the whole idea of processed food, in the course of processing it, they're taking out nutrients and minerals and vitamins, as you say. And plus, things like refined products, whether it be refined sugar or refined flour, it's not natural. It's, we all are going to have, you have it in the course of a day, but the fact is that when something is refined, chemically refined, they're stripping it down, they're taking out the essence of it, and you're getting a product that goes right directly into the bloodstream. Now, places like Dunkin' Donuts, I don't mean to single them out because they all do this, they actually have chemists who try to figure out how to refine the product so that you get hooked on it. Because if it goes right into your bloodstream, not only does it taste better than anything is supposed to taste, but it gives you a sensation that makes you crave more of it. And they are selling a product, so they want you to get more. And so thus they're using refined white sugar and refined white flour that is stripped of any nutritional value.
Right. Yep. And it's interesting if you really look into the history of the refining. The only reason to do that is to make it white, to make the flour. They bleach the flour and to make the white sugar. Because why? Because it made the pastries and the foods look more presentable. That's all. It is so ridiculous from a nutritional perspective that you would refine flour or that you would refine sugar. And it's interesting in today's day and age, you see so many other recipes and people going, no, I'm going to use sugar in the raw, and I'm going to use simply ground up, cornmeal. I don't need to go and bleach the flour and then reintroduce. And what they do, then they fortify it with vitamins and minerals, and that's a leftover log.
Right, they take it out and then they put it back in.
And they have to fortify it because they stripped it. There was nothing in it back in the early 20th century. And so what was happening? Children were getting rickets. So they had to refortify all the breads during the Depression. Why? Because that's where everybody went to, is grains and breads. And so they had to fortify it because people were getting sick, causing other illnesses that were then being transmitted. So when you look at the reasons why, and now here we are in the 21st century, it's no longer needed. We don't need all the chemicals and the preservatives and the salts and nitrates and the meats and the foods and things, because those were back then when we couldn't transport something from the East Coast to the West Coast in a timely manner in a refrigerated semi. Guess what? Now it's overnight, it's here. Those chemicals can actually all be removed because it's almost fresh daily, and you see that in the change in people that just eat what they, farm to table every day.
So they're taking all of the good stuff out of it, and then they put it back in the form of a chemical.
Mm-hmm.
I mean, it kind of reminds me of the way taxation works. I mean, they'll take the taxes and they bring it all to Washington, and then they hand a little bit back to the states with strings attached.
Right.
As opposed to leaving it at its source. And it's I think that there's a more sinister thing going on here than just trying to make it look white and make it look pretty. But that's me.
Now it's different. Now they realize that, yes, they want to get you addicted to it. There's all these other chemicals and dyes and preservatives and things that they don't even tell you about. But originally, the reason it was bleached, the reason it was white, was because it would present prettier as a white when you bake something versus if you baked a brown meal versus a white meal. There's a different look to it, but that's the only reason why it started. And now,
right, it's just a matter of marketing, and again, I don't mean to pick on Dunkin' Donuts here because that's what's in my neighborhood. I mean, Dunkin' Donuts came from Boston, where I am, but their scientists and their chemists could just alter that donut very slightly and take some sugar out of it, and nobody would notice the difference. People would still order them just as much as ever. They would still taste just as good. Nobody would, it wouldn't matter. But yet they could reduce obesity and they could make people healthier in a mass level if they wanted to do that, but they don't want to do it.
Well, and this is where, I'm disappointed in the legislatures and the government organizations that allow these things in, whether it's the Food and Drug Administration, whether it's the marketing from the FTC, whether it is the regulatory agencies that have allowed and continue to allow these chemicals to be used, and they serve no other purpose. And many times they don't even have the research behind them. I mean, how many chemicals can you think about in your lifetime, from the early sweeteners of the 70s that came out to aspartame?
What is it, saccharin? I mean, those things aren't even around anymore.
And they said back then, what did they say? Just like the smoking industry. No problems. It's safe. It's we're going to believe you that want to sell it to us versus having an independent. And what did it take? It took 10, 20, 30 years, whatever it is. And where are they? They know they're bad chemicals. They know they cause all kinds of neurological issues and diseases. And now they're gone. And who suffered for it? The American people and other people of the world.
Yeah, I mean, I remember my mother used to have a little vial of saccharin on the table, and they would drop little saccharin pills in the coffee.
Yep.
You don't see that anymore.
Right. And
anyways, that's right. Anyway, Al Sanchez, talk a little bit about your practice and what you're doing over there and what's up with you.
So I don't practice medicine. I work with the doctors that are putting together the protocols for the degenerative diseases that we talk about. So I get to sit back and coordinate and see, these patient populations, primarily my heart's in cancer because of the death of my sister and my mom. So we look at those integrated protocols that work best for cancer patients to keep them going through the treatments, the palliative care, and integrating, like we talked about earlier, various protocols that can support that aspect of it.
And would you like to give out information in terms of how my viewers and listeners can reach you, and what do you offer any particular products?
So we do. We have a lab there that's actually in Long Island, New York, that manufactures a product called PolyMDA, and it's a dietary supplement that integrative practitioners utilize for the exact reasons that we talked about. So the poly stands for multiple, so there's multiple ingredients that are in it. And then the MVA stands for minerals, vitamins, and amino acids. And these cofactors are put together in a way that they support not only the immune system, but the normal aspect of how we talked about growing up our cells earlier, about cancer cells. Cancer cells are just cells that didn't grow up. And what I mean by that is they have a different metabolism. And if they stay in that metabolic cycle and can just continue to swim in that, then that's where you get tumor growth and problems that go down the road. If you can get your immune system and your body to either repair that cycle or turn it off, well then that's how our body normally takes care of cancer. You have cancer right now. I have cancer. Every person on this planet has some form of cancer in them right now. It's simply an abnormal cell. The difference being is that the body, the immune system, sees it, recognizes it, removes it, and then you continue on.
Very interesting. And I also think that there's some interesting research right now in cancer detection, which is important, because if you know in advance that you might have a greater propensity for cancer, you can deal with it in advance. So these are all good things. Anyways, Al, I want to thank you for joining me this afternoon.
Thanks for having me.
And let's stay in touch. I'll talk to you soon.
All right. Take care, Charles. Be well.
All right. Thank you.
Okay.
Bye-bye.